My name is Jan O'Neill, and I'm a community coach with the County Health Rankings and Roadmaps program, and I'm joined by my colleague, Kate Conkle. Hi, Kate.
Hello, everybody.
And as we go through this presentation, we'll be taking turns answering your questions as well as sending out links via the chat box. Kate has already chatted out the slides for today's webinar, and you'll find slides and a recording of today's webinar posted later this week on our site. We also wanted to make the point that this is a 101. This is our standard 101, although we have updated it with some new examples and tools that will help you focus on health equity issues. But we are not going to be going into new measures this year, but we will in January 19th. Amanda Jovag will be doing a data in-depth webinar, so you may want to check that one out. But this is our Standard 101, and we are delighted to have you here with us. So we would first like to acknowledge the important relationship we have with the Robert Wood Johnson Foundation. The County Health Rankings and Roadmaps program is a collaboration between the Robert Wood Johnson Foundation and the University of Wisconsin Population Health Institute based in Madison, Wisconsin, which is where Kate and I are right now. Pretty cold Madison, Wisconsin. And this program is the result of the contributions of many, many partners, including those listed here. A little bit about the technology we're using today. The GoToWebinar attendee interface has two parts. On the left, you can see the viewer window where you will see our screen throughout the presentation. And on the right, you can see the control panel. And you'll find the handouts for today's session, including a PDF of our slides and a list of related links I believe will be up there soon, or that we'll be sharing during today's presentation. And you can also interact with us through the control panel by using the questions section. So please feel free to ask questions or share your thoughts and experiences with us via the control panel throughout the webinar today. And we'll be sure to leave time for your questions. So without further ado, let's take a look at what we're going to talk about today. We'll start with an overview of the County Health Rankings and Roadmaps program, and then we'll demonstrate how you can use our site to explore the rankings data. I'm actually going to be transferring the presentation mode over to Kate, who will be taking us into the site periodically throughout the presentation. So you might see a little bit of a blink on your screen, but don't panic, that's just us changing presenters. We'll also be talking about the tools for taking action, and we'll take a look at how the Roadmaps Action Center can help you move forward with action and how you can learn from others. And throughout the webinar, as I said, we'll head over to countyhealthrankings.org to see how the site functions. So you're going to walk away from today's webinar able to confidently navigate the site. So I want to start with this guiding question. The Robert Wood Johnson Foundation has laid out a powerful vision for building a culture of health in every community in the country. And that vision includes the belief that all individuals and families should have the means and the opportunity to make choices that lead to healthy lifestyles, regardless of where they live. So we start with this question: how can county health rankings and roadmaps help you build a culture of health in your community? This image comes from Cambridge, Massachusetts, and they had all of their community partners put their names on strips of fabric, and then they wove them together into a tapestry. It visually represents the power of collaboration to bring diverse partners together to create something new. A partnership, working with diverse partners from all walks of life, is one of the ways Cambridge is building a culture of health. So what does your tapestry look like? Is it helping you build a culture of health? Similarly, this County Health Rankings and Roadmaps program is made up of many components that work together with a common purpose: to build a culture of health county by county. And as we share the various components that make up the County Health Rankings and Roadmaps, we invite you to think about which piece or pieces of the program you can use. So let's start by reviewing a little bit about the County Health Rankings. This picture shows the thinking behind the rankings, our theory of change, if you will, about how the rankings can be a catalyst for action that improves the health of everyone in a community. We start with population-based data from a variety of sources. So we don't make up the data. The data comes from all over a number of different sources, and you can go on our site and see where they come from. So we start with that data that others have collected, and then we use that data to rank the health of nearly every county in every state. And that's nearly every county in every state, if there's enough data available. The rankings take several different pieces of data and simplify them, and they give the communities a quick and easy snapshot of their health and of the many factors that impact how well and how long people live. And each year, the rankings released in the spring, and this year it's going to be March 16th, generates national, regional, and local media attention. And some of you may have read about this release, and you may have been quoted in stories about how your county compares to others in your state. It's like an annual doctor's checkup, if you will. And this provides an opportunity for people to tell the story of the many factors affecting health in their community. Community leaders can and do use the rankings release to get the word out to their community and to the local media to help people understand the full, broad nature of the health status of their community. And they use the findings as an opportunity to mobilize multiple sectors to look further at their community's strengths and needs. Based on this deeper look at their unique priorities, community members then identify evidence-informed strategies that can be implemented locally to make change. And then over time, these evidence-informed strategies ultimately result in longer, higher quality lives for all the children and adults in your community. So essentially, the county health rankings, they really aren't about numbers. They're all about a call to action. The rankings are a starting point for discussion in communities, not an ending point. Communities will want to dig into local data to further understand what's going on in order to know where and how to take action. So the horizontal portion of the model underpins the rankings, and that shows us that where we live matters to our health and that a broad range of factors impact how long and how well we live. And then the vertical portion underpins the roadmaps. The roadmaps offer communities guidance and tools and resources to move from awareness to action to create healthier places to live, learn, work, and play. So we're going to start with the horizontal section, the rankings section. So as I said, the County Health Rankings ranks the health of nearly every county in every state once a year. And for each county, you'll find two rankings, one for health outcomes and one for health factors. And this is because there are two separate sets of messages we want to convey with the rankings. How healthy a county currently is, and these are your health outcomes in green. Think about this as your today's health rank. And then we also want to call attention to how healthy a county might be in the future based on the many factors that influence health. And these health factors are in blue, and we call this rank tomorrow's health. So you'll see these colors in the next slide. This is one of the most important images that we'll share with you today because it shows what we use to determine the county health rankings and what influences health in a community. The model shows the relationship between policies and health factors and health outcomes. It illustrates how multiple factors impact how well and how long we live. And things like how we commute to work, and housing conditions and access to parks and the quality of our schools, availability of jobs, access to healthy foods, and clean air and water, and our social connectedness. All of these impact our health outcomes. So starting from the bottom, we know from the research that effective local, state, and federal policies and programs can improve a variety of factors that in turn shape the health of communities. And then these many health factors in the blue boxes shape our community's health outcomes. We specifically look at health behaviors, clinical care, social and economic factors, and the physical environment. And we measure two types of health outcomes in the green boxes to show how healthy each county is, length of life and quality of life. So let's just take an example here of a policy focus. So expanding early childhood education improves academic achievement, and higher levels of education lead to higher levels of income, which then influence other health factors, such as access to healthy foods, clinical care, and quality housing, which in turn influences health outcomes. So they're all interconnected. Now, stepping back, you'll note that we don't include race or ethnicity in our health factors. We've selected health factors only ones that reflect aspects that communities can improve, can take action on. And race and ethnicity are not modifiable, while poverty is something we can take action on. So you will see income as a key health factor. We do provide data and tools and resources that can help communities address health disparities, and we'll show you a little later where to find these on our site. The bottom line is that factors such as one's race, ethnicity, and socioeconomic status shouldn't play a role in how healthy we are or how long we live, but unfortunately, for many people across the nation, they do. And if we're going to build a culture of health in every community, reducing health disparities needs to be a top priority because everyone in our society deserves an equal opportunity to pursue a healthier life. And Kate has chatted some links to address health disparities. You'll see those there. So a culture of health is where everyone in a community has an equal opportunity to enjoy good health. In other words, we're talking about health equity. Health equity includes a shared commitment to identifying and addressing gaps in opportunity that tend to disproportionately and negatively affect certain populations. Health equity is a basic principle that all people, despite race, ethnicity, limited English skills, gender, age, religion, income, educational level, geographic location, sexual orientation, or ability, all have equal opportunity to lead healthy lives. It also means creating a sense of community where all individuals, especially those most affected by poor health outcomes, feel they have a voice and a role to play in creating and implementing solutions. Healthy People 2020 calls for valuing everyone equally, addressing avoidable inequalities, and eliminating health and healthcare disparities. So I'd like to just take a moment to break this down with some examples of policies that have led to current inequities. Access to affordable housing is key to health. Generations ago, during President Franklin Roosevelt's New Deal, the federal government started subsidizing a lot of housing, but they funded programs that allowed whites to move into new suburbs like Levittown, New York, while the options for people of color were public housing apartments in the same city centers where they already lived. And over the generations, the suburban homes greatly increased in value, creating wealth for the white families there. Meanwhile, even though laws have changed, allowing people of color to have the right to buy into places like Levittown, many of these homes are now selling for $500,000, out of range for many, many people. As another example, because of a history of women being excluded in the workplace and women's jobs being differently valued than men's, there are long-standing income disparities between women and men. For example, in 2011, American women who worked full-time, year-round, were paid 77 cents for every dollar paid to men. And for women of color, the wage gap was even larger. And today, women still make only 79 cents for every dollar men earn. Although the gap varies considerably across occupations, overall, women earn less than men. And this has a significant impact on families, especially working single mothers. But two-parent families who depend on women's wages are also affected. So as we walk through the rest of our program, we invite you to consider how you might work with those who are most vulnerable to help them identify what changes are needed to improve health outcomes in their communities and help them find the data and solutions they need to make their case to policymakers. Now, stepping back to the model, having looked at many factors that contribute to health outcomes, let's take a look at how the measures are selected. As we mentioned, we want communities to take action, so we use measures that reflect aspects of a community that can be improved. They have to be valid, reliable, recognized, and used by other similar national measurement or rankings projects. For example, many of our measures are used in America's health rankings, which annually measures the health of states. Our measures must be available at the county level for every county in every state. And the data we use must be not only available, but available at low cost or free, and as up to date as possible. But we can only take the data that's available, so we're somewhat beholden to that. And I know that's one of the questions that came up was the dates on our data. And we used fewer measures, 35 measures in 2015, because the rankings are meant to be a snapshot. And as we seek measures that help highlight health gaps, for example, our children in poverty and income inequality measures. Those are data that help highlight health gaps. The county health rankings data aren't intended to paint the whole picture of a community. They're just a starting point. So having looked at the model and the measures, now we're going to take a brief look at the county example. What does it look like on our website? And Kate is going to take us into the website itself, and we are going to do screen sharing. And so you'll see a little blink here. So Kate.
All right. So you should all be seeing the live website now, the home page here, and we'll give Jan a little chance to rest her voice, and I'm going to take us on a little drive, a little spin around the website. So I think one of the great things about our website is that it's really interactive, but it can be a little challenging to find things sometimes. So we're going to walk you through where you can find different things and how you can get to different pages and what you'll find there. So we're going to start up at the top of our website here with this navigation bar. So on the navigation bar, you'll see the different areas that we have within County Health Rankings and Roadmaps. So you'll see the Health Rankings tab, and under that, you can learn more about our approach. Jan just walked us through that with our model. You can also learn more about the rankings methods, using the rankings data, and measuring progress. You will notice if you're spending a lot of time on the site that as you hover over things, they will eventually disappear on you. So just re-click it when that happens. So next, we have the Roadmaps to Health tab, and under this tab, you'll see the Action Center, and we're going to dive deeper into that a little bit later. You'll also see a tab where you can learn more about the Roadmaps to Health coaching and what works for health. We'll dive into what works for health later as well, and then you'll find stories and information about some project showcases and national partners. So lots of information under each of these tabs if you haven't explored those yet. Moving over, we have the Culture of Health Prize. This is a great place to go and learn more about those prize-winning communities and some great work that's happening around the U.S., potentially in your own state, where you can get some ideas about how communities are already doing some great work to build a culture of health. And you'll also see there posted, once we're ready to open that the open applications, that's where information will be posted as well as that process unfolds later. And then finally, this More tab. This is sort of the catch-all for things that don't necessarily fit neatly under those other tabs, but we've got, or that maybe cross all of those other tabs. We've just got some information about the project. We've got some frequently asked questions there with some answers, and then information about webinars like the one you're on today, but also more upcoming webinars. Jan mentioned the one on methods and measures that's coming up in January, and then our tools and resources tab. And this is sort of a great place to go if you're looking for a specific tool and you don't want to go into maybe the Action Center, and we'll pop in there later as well. If at any time, whatever page you're on the site, you want to come back to this home page, you can just click this County Health Rankings and Roadmaps tab at the top, and that will take you right back to this home page. So scrolling down, you'll see in the middle of our page, we have our map of the U.S. And here you can search for your your county or your state if you're looking for your county level snapshot. You can search for that here. You can also search for it in the search bar that's up on that navigation bar. Or if you're interested in a specific measure and what your state looks like there, you can come down to this tab, the select a measure, pick your state, and it will take you directly to that specific measure detail page for your state. So maybe a shortcut if you really know what you're already looking for. So that's a quick tour of the home page. You'll see there's lots of links to our blog, to latest stories, so lots of ways to get more information on the project. Usually when we've got new things happening, you'll see them up at the top here above that map, so it's a great place to see. So right now you'll see that the health gaps report are being highlighted. If you haven't taken a look at that, it'd be a great thing to look at for your state. All right, so we're going to now, Jan talked about our county snapshots. We're going to go take a look at one, and we're going to go into Dane County. So again, I could search for Dane County right up here in the search bar, and that would take you right to the snapshot. That's a quick way to get there. We're actually, though, going to go to our state landing page so we can show you a bit more information that you'll find there. So we're going to go into our state of Wisconsin. We'll just click on that state. And I'll scroll down a little bit so you can see these maps a bit better. So this is the Wisconsin landing page, and each state has one that looks very similar to this. You'll see that we have maps for both health outcomes. Those, again, are in green. As Jan mentioned, we color code all of this. And the maps for health factors, they're in blue. You'll see that the lighter shaded counties are the healthier counties for each of those, and the darker blue and darker green counties least healthy. All right, so a lot of people sometimes only get to this part of the state landing page, but I want to point out that we want you to keep scrolling down. So here's another place where you can access your state health gap report right here on your state landing page. But there's also a lot of great tools and guidance that you'll find if you keep scrolling down. So we provide some great data and a great starting point for your community to think about data in your county snapshot. We'll go into that in a moment. But there's also an opportunity to find more data, some additional data sources that may help you get a more complete picture of health in your community. And these are generally state specific, so they'll vary state by state, but this will link from your home page directly to your state data sources. You can also click into the Action Center from here. We try to put links to that in many places so you don't always have to go back to that home page or that first screen. And then continuing to scroll down, in addition to more data resources, we have additional community health improvement resources that are specific for your state. So hopefully there's some helpful things in there. You can find stories that are from your state. So again, if you are looking for some examples of work happening where you live or close to where you live, this is a great place to find those. And then you'll also have your state contact. And these are people that we connect with to help get information out to people in the states, but that are also great contacts for you if you are looking maybe for some more specific information that might be more state specific. So lots of good information on this landing page. So we hope that you, again, continue to scroll down after you get to these fun and interesting maps. And now we're going to click into one of those county snapshots. So I'm going to click on Dane County. And this is a small map. You can adjust the size of the map on your screen by scrolling. I'm not going to do that now just for sake of time, but if it's too small for you, that's always an option. I know some of you have really tiny counties in your state. So let's click onto Dane County because that's where Jan and I are currently sitting today in very cold and blustery Dane County, Wisconsin. Good thing we're not ranked on weather. So here is the Dane County snapshot. You'll see on the very left-hand side you have all of the counties listed by their rank. You can switch this up and click on that county if you are looking for an additional county you want to see, and it will list it by alphabetical order if that's a little bit easier for you to find. So you can look at and search those from this page both ways. I'm going to switch that back to the rank right now. So here you'll see we have on the left-hand side of your county snapshot listed all of the measures. They're divided into health outcomes. There we think about length of life and quality of life, and then the health factors where we look at health behaviors clinical care, we'll scroll down, social and economic factors, and the physical environment. We'll scroll back up here. So you'll see that each county gets a rank, an overall rank for health outcomes and one for health factors. And these aren't always different, and sometimes they can be quite different from each other. And it's good to have that discussion about what that might mean if your ranks look pretty different. So the ranks are over in this far right column. The column next to the measures that we list is your county level data. So this is the data that's specific to your county. We also provide a margin of error just to give you a little bit more insight into the data from your community. We provide the data for the U.S. top performers. So these are sort of, we think of as the A students, the top 10% of counties in the U.S. So this is more of an aspirational number to see how you might compare to those best performers. And then we also provide your state average, so you can see how you compare to your specific state as a whole. You'll also see we have this column that I skipped over, the trend data. For 12 of our factors, we provide trend data. And they're these little squiggly lines. They're color-coded. This little blue eye up here will tell you what those mean. So the red, if you have a red squiggle, little trend graph, that means that your data is getting worse for that particular measure. If it's yellow, it means it's staying about the same. And if it's green, that means that your county is actually improving on that measure. So we're going to go ahead and click into this yellow trend data for physical inactivity in Wisconsin, just so you can see what it looks like. We actually provide you the information for your county, for the state, and then this is the U.S. average. So don't mix that up with the top performers. This is the U.S. average. And you can see how you fit with all of those other things. So you'll see Dane County is blue. Your county's the blue line, your state's the green line, the U.S. is the orange line, and this way you can see if your trend looks similar to the state and national trends, if it looks drastically different, if you're improving and other people aren't, if you're going in maybe a negative direction and other people are improving. It gives you a little more insight into some of the trends over time as opposed to just your one point in time data point. All right. So one other thing I want to quickly point out is we sometimes get questions about, years of data used, or what do you measure when you're measuring adult smoking or poor mental health days. A quick way to do that is to just scroll over, and a little pop-up box will come up and tell you exactly what that measure is looking at. So again, poor mental health days is the average number of mentally unhealthy days reported in the last 30 days. Maybe you need a little bit more information about this though. So you can click on to any measure and it will take you to your measure detail page where you'll see, again, another color-coded map to give you a sense of how things are spread out across the state. You can also go in and see the actual data for that. You can also click on this description and it will take you to a more detailed page about what the measure is, where we get the data, what the limitations are, and then the data source. So this comes from the Behavioral Risk Factor Surveillance Survey. So lots and lots of information. You'll also see on this left-hand side is sort of the quick cheat sheet of the summary of the measure, how much weight it's given in the health outcomes, and then the years of data used and that kind of information. So there's easy ways to spend lots of time on this website, but we hope there's some really helpful information that can provide you with some more information as you're going through. I'm going to look to Jan to see if there's anything else that I missed that we should be covering in this section before I hand things back over.
Yeah, thanks, Kate. This is great. And also, I think what we want to let people know about, let's go back to the snapshot that we do there. If you're really focused on equity issues, which we know we are all focused on that, there's some key measures like income inequality just got added last year. And so if you click on that, you'll see a full description of that and how we came up with that and how all of the counties are, in what order they look in your own state. So The other thing I wanted to point out was policies. So you can actually, on income inequality, and this was a question that came out in the pre-registration, you can actually go under that measure and find in what works for health some strategies that you might find in your community would be effective. We're going to spend some more time in what works for health later in the webinar, but we just wanted to point that out. And then the other is when we get into, I think you're going to take us into tools for understanding our data and using the rankings data and measuring progress, because another question people had was, how do I improve my ranks, my rank of my county? And ranks are really, they're relative. They're not absolute, and they're a starting point for the conversation. So you might see a rank stay the same, or you might see it bounce around. If your county improved but another county improved too, you might not see an improvement in the rankings per se. But if you dig under the hood and look at the measures underneath, and that's what Kate was showing us, you'll see trend data. And then I think she can also take us into some using the rankings data part of the site, and she'll show us how we can dig for further data.
Yeah, that's a great point, Jen. So I quickly had pointed this tab out, but if you go to the health rankings, again, up at the top of this navigation site, we've got two tools. Mine's not being very cooperative right now. There we go. Using the rankings data and measuring progress is another great tool. If you go into the using the rankings data, there's some guidance here on how you can better use and understand the rankings data and explore your data. I think the digging deeper is a really important piece to look into here. This is, again, provides you some questions and guidance about how to think about, we give you a broad county perspective, but there's differences within your county. And so starting to think about what those differences might be, and especially as we think about health equity and health disparities, what do those look like? And this gives you some questions to ask and think about. And then, again, we have those places where you can find some additional data that you may be able to find some data at a sub-county or demographic level that could be really helpful in helping you to answer some of these questions. So again, up in this rankings navigation spot, we've got that tool along with the measuring progress. So we strongly encourage you to read through both of those as being really helpful in helping you to understand better how to use the rankings and then how to take it to the next step and use the rankings as that starting point, but how do you continue that conversation? All right. So I think that's the end for this first part of our website tour. I'm going to hand things back to Jan, and I will join you again in a little bit to talk about some of the other non-data parts of the website.
Great. Thanks, Kate. Thank you very much. That's wonderful. So hopefully now you feel comfortable finding and using your county snapshot. So I'd like to take us back to our thinking behind rankings and roadmaps. Roadmaps, remember, addresses the vertical section. So assuming you now have your community's attention with the rankings snapshot and underlying data more at a local level, we want to help you find the best possible strategies to impact your community's health priorities. So this is where communities take action to improve health, but how do you do this? And how do you do this? And how do we do this with a health equity lens? So along the way here, we'll point out some guidance and tools and resources in our Action Center. And Kate is going to be chatting out some links from our Action Center for creating health equity. And I did let you all know, too, that there's a chat link document that will have all the chat links in it that's going to be part of this webinar. So this is, remember again, if you go into roadmaps, you'll find the Action Center is one of the links to go to, one of the pages. And in the Action Center, what you'll find is a variety of tools and guidance, everything from working together to evaluating your efforts. And what we're providing here is an online sort of one-stop shop of practical help and guidance for communities that are working together to improve health. And we've also got strategies in there, which we'll show you. And it also gives you access to community coaches. So Kate is going to take us back to the website and take a look into the Action Center now.
Alrighty, so when we last left off, we were in this digging deeper part of the using the rankings data tool. Now we're going to move to the, once you've done this, you've really thought about, looked at your data closely and you want to do something about it. What tools are available to help you with that? And that's, as Jan just mentioned, the Action Center. I'm going to go back to our home page. Again, I just clicked that County Health Rankings and Roadmaps button up at the top to show you. You can get here by going into the Roadmaps to Health tab right here. You can go and click on that Action Center. Again, mine's not being cooperative right now. Yeah, you can hit the refresh button when that happens. But I want to show you the other things. Again, there's some information about the Roadmaps to Health coaching for those of you who are interested in connecting with one of our 11 community coaches. We're going to go into what works for health later as well. We also know it's really important to learn from each other and to learn from other communities that are in the middle of this and doing this work. So we've got stories and project showcases, and you can click into there to see those as well. But you can click into the Action Center from here. If you're like, oh, now it's going to cooperate, like me, if that button isn't cooperating from some reason, you can also come down here to the Get Step-by-Step Guidance from the Action Center. I showed you where it was on your state landing page. So there's a number of ways to pop into the Action Center, and that's where we're going to go now. So the Action Center is sort of the online hub for a lot of different resources that you can use to help your community think through the best way to improve some of those different health factors in your community. We have several different action steps, and when we look at this Take Action cycle, which is this graphic, this picture that you see here, you'll see that, whoa, one, it's interactive. As you scroll over things, different things are going to pop up, which hopefully will help you to get a better understanding of these questions as they pop up in the middle, or to hopefully help you to have a better understanding of maybe what step of this action cycle you're in. You'll see that we have 5 steps in this inner circle here, this maybe middle circle, I should say. We have our 2 hugging steps, what we call our hugging steps, because they're sort of encircling the other 5 of work together and communicate. And then we've got those people, all of these different partners in the middle, with community members really at the center driving the action. You can click on any one of these action steps or partners to get more information and guidance about either, if it's a partner guide, sort of their role, your role in helping to improve community health and some specific tools and resources to that particular sector, or you can click into the action steps to help you see what tools and resources are available to you there. You can click on them both from the graphic. You can also come over to this menu on the left-hand side of the page to get more information about that step. So I'm going to click into Work Together. And when you click into a guide, I'm going to scroll down here, you'll see that we've got some information about this step as a whole, the purpose, who you should involve. Generally, it's going to be a lot of those key partners that we saw at the center of the cycle. And then we break each step down into key activities. These are big and challenging actions to work through, and so we want to break it down and provide some guidance. It also helps you to see, where you might be in the process. Work together is one of those things that you're doing throughout the cycle. So whether you're in assess needs and resources, or you're trying to select strategies that you think will be the best to implement in your community, you're always coming back to work together. When we click on a key activity, we'll click on this first one, recruit diverse stakeholders from multiple sectors. You'll get some guidance on how to actually work through that particular key activity. Some are very short, some are a bit longer and more texty, as this one is, but there's some really good information there that we've gathered from a number of different resources. You'll also see that we have some suggested tools that link with that particular key activity. You'll see 5 listed here if there's at least 5 tools. You may also see, though, a little drop down that says View All Tools, and this usually means that there are more than 5 tools. And so to see the rest of them, you're going to want to click on that drop down to see the rest of the tools here. And then you can click into a tool. It will take you to a tool homepage that will give you a bit more information and how to actually get to that particular tool. I'm just looking to see, make sure there's nothing. We also have some community and action stories. I'm trying to think if we have one, what tool we have one with. But community and action, you'll see them in Work Together, and you'll see them, yeah, you'll see them in our Work Together guide as well. And these give some information on how a community has used that specific tool. And actually where it's not in the tools, it's actually in the action, it's in the action step, and you'll see it right here. Yep, so here's our community in action for this particular key activity. You'll see these scattered throughout the Action Center. You'll see them scattered throughout Work Together. And this is sort of a snapshot of how communities are actually working through this particular action step, or potentially through with a specific tool that's listed for that key activity. So these can be really helpful sort of examples of what it looks like in the boots on the ground communities working through this kind of thing. And they generally also have contact information or a way to learn more information, which can be great if it's something that your community is really interested in. Another way to get, though, to tools and resources, we have lots of obviously connected through these key activities in the Action Center. But sometimes you know exactly what you're looking for, and you don't want to have to go through the process of going into the Action Center and searching, or maybe you know a specific topic that you're looking for, but you don't know where it would actually fit into the action cycle. So again, under that More tab that we talked about, I'm going to refresh quickly. This sometimes helps if your website's being a little wonky. Under the More tab, if it lets me do it, all right, it's not cooperating right now. You can go to the Tools and Resources page. I'm going to try one more time. All right, I'm going to finish my part of the website tour, and then maybe we can try again later when we go into what works for health as well. I'm just getting back from a break, and my computer has been a little wonky. But you can also search for tools there. So for instance, you could search for equity, and it would pull up some different equity tools. We'll chat out those links to you. And it will pull up a number of different tools related to equity. So if that's something that you're interested in, and those tools are going to be scattered again throughout each of those different action steps, it will allow you to find all the tools and pull all those tools connected to that particular search word. So there's lots of different ways to get into these tools and resources. And then I think another important thing is that sometimes people, you know, they find a bunch of tools and they aren't sure which ones they want to use, or maybe how to use a specific tool. All over the website we have Get Help buttons that you can click on, and it will send you to a page where you can send a question that will get sent to one of our coaches to respond. So if you are stuck somewhere, you're not sure how to use a tool, which tool to use, you can just send a message to a coach, and we can help you figure out what your work through whatever that challenge is. So I'm going to hand things back to Jan now, since I'm having a few technical difficulties, and she's going to share a bit more. Hang on.
Okay, thanks, Kate. That's great. All right, so I'll do a few slides here to sort of set up what works for health, and then we'll go back in just one more time and take a look at the what works side of our site. So the roadmaps offer communities resources, as you saw, to move from awareness to action, and there are 5 foundations. of roadmaps. It takes everyone, all of us working together to improve the health of a community. And we need to move as quickly as possible from data action to action, not get stuck in analysis paralysis or drowning in data. And we encourage communities to look to the evidence to inform these actions. And if you innovate, be sure to evaluate. And keep focused across all the health factors, including social and economic factors. And prioritize efforts to focus on creating better opportunities for health for all community members, especially those who aren't as healthy as others. And finally, don't be afraid to take on policy, systems, and environmental change, which will in the long run create the greatest long-term change in health for the children and adults in your community. So now let's take a look at the resource that we have to help you select evidence-informed programs and policies. What Works for Health provides communities with information to help select and implement evidence-informed policies, programs, and system changes that will improve the variety of factors we know affect health. So before we go there, though, with Kate, let's just talk about why evidence matters. Because when it comes to developing and implementing solutions to problems that affect our communities, using what's been shown to work can drive smart investments. None of us have a lot of time, money, or resources, so choosing strategies that have been shown to work can help you stretch the impact of scarce dollars and resources. And knowing whether there are strategies that effectively address your community's priorities can help inform decisions about when to adopt existing strategies and when to take more innovative approaches. It's important to understand what's been shown to work and what hasn't when creating new solutions. Explicitly considering what works can help to ensure that your innovative solutions are effective. So now let's go back to the website, and and Kate's going to try it again. And here we go.
All right, we're going to see if it's a bit more cooperative now. I've refreshed it a bit. So we talked about the Action Center. Are you muted, Jan? And now we're going to talk about that specific tool. You'll find it both in the Action Center in the Choose Effective Policies and Programs guide, or you can just go, all right, this was just working. Hang on, I'm going to try one more time. Otherwise, I'll show you the long way to get there. Okay, so you can go right to that in the drop-down menu when it's being cooperative. Otherwise, you can always come into Choose Effective Policies and Programs. You get an additional tour of the Action Center. And one of the tools that we have in this guide is in Explore Policies and Programs, I believe, yep, is What Works for Health. So there's a workaround. if you ever need it. Now you know the cheat sheet. Okay, so now we're on the What Works for Health landing page. Here we've got, you can come up here on the left-hand side. This menu has a bunch of information about how to use What Works for Health, information about our evidence ratings. So if you're not sure what we mean when we say scientifically supported or mixed evidence, you can come in here and you'll get some information. There's more information about the methods if you're really curious about sort of the more nitty-gritty details of how our evidence analysts come up with those evidence ratings. You'll also see on the right-hand side here, we're constantly updating What Works for Health, so the new policies and programs as they're being, ones that have recently been added, will show up here on this right-hand side of the page, and you can, here's a link to 2 of them, but you can browse all of those that have been recently added. Another really great thing to keep in mind is this 4-minute tutorial. It's really short. It walks you through step-by-step how to use the What Works for Health database. So if you're sharing this tool with someone else or you haven't been in it in a while, really quick, great tutorial and overview of how to navigate through this website or this part of the website. And then as we scroll down, you'll see hopefully this looks familiar to you. This is part of our model. And we link each of the policies and programs to these different factors in the model. So if you know that your community is working in one of these specific areas, you can click right into that specific area to find policies and programs that will work to address that factor. So let's say your community is working on income. We can click into income, and here we'll find there are 16 results. So there are 16 policies and programs, 16 strategies that our evidence analysts have looked at and rated for their evidence of effectiveness. You'll see that they're listed alphabetically, and then next to them is their evidence rating. So we've got the first two are expert opinion. The next one is insufficient evidence. And then we've got some that are scientifically supported. So you'll also see, this one has 16 results, not too many to scroll through. Some of them, like diet and exercise in particular, has a lot. So you can always sort these as well. You'll see on the left-hand side some sorting options, like you can sort by approach. You can sort by the decision makers involved in deciding, implementation there, or by the evidence rating. So maybe you only want to look at scientifically supported or ones that have some evidence. So you can always do some different sorting. So we're going to click into one of these so you can see what an entry actually looks like. And I'm going to click into Earned Income Tax Credit, which is scientifically supported. Again, here's that evidence rating thermometer, so you can scroll over that. It tells you where this one sits, and then it also gives you a bit of a definition, again, another little good cheat sheet of what we mean by that particular evidence rating and all the evidence ratings. You'll see for each of the entries we've got description, we've got the expected beneficial outcome, so what we would expect when we implement this particular strategy. Sometimes, though, there's other potential beneficial outcomes. It's not what the strategy was intended to impact, but we know sometimes there's unintended consequences as well, and sometimes they're beneficial. So these are some of those potential potential beneficial outcomes. Then we list what the evidence is for that particular strategy, whether it's will potentially have an impact on disparities, and then if they're available, implementation examples and implementation resources. So lots of great information to help you sort of sift through and better understand specific strategies. You'll also see, here's another community in action, this one with the Kentucky Youth Advocates and their work to pursue earned income tax credit to help children and families. So you can click into that and learn more about their work around this particular strategy. So this is a really great place to either start to get some ideas of what strategies your community may want to use, or to look to see if you've already got strategies in place, what the body of evidence that is available says about how effective they are. And we certainly encourage you to look across all of those different evidence ratings and see what's a good fit for your community. And then just be aware that if you're doing some of those ones with insufficient evidence or mixed evidence or even expert opinion, that you want to make sure you're really thorough with evaluation. So I'm going to hand things back over to Jan to make sure that we've got time to wrap things up and take some questions. So.
Okay, great. Thanks, Kate. So just wrapping up the what works for health piece, the choosing strategies, just to underscore what Kate said, remember that evidence is just one of the factors to consider when choosing a strategy. Be sure you also be thinking about the fit with your community, how ready your community is, what your priorities are, what the impact might be on your vulnerable populations, your capacity for implementing or adopting the strategy, and your resources. And in the choose section of the Action Center, you'll see some tools for helping you sort through those questions. So as you move forward in your own community health improvement journey, we invite you to focus on the 5 Ds. Investigate the differences using digging deeper and other data tools to understand differences between subgroups, and focus on the drivers that most influence health, policies, systems, and environmental conditions that create opportunities for good health. Dig into root causes. Determine the most effective strategies, especially strategies, if directed toward those in greatest need, will reduce health disparities. And finally, the Nike approach, just do it. Harness the collective power of your community to take action. We'd also like to take a moment to introduce you to the RWJF Culture of Health Prize and let you know that these are the 6 criteria that are central to the prize. The prize recognizes and celebrates communities that have placed a priority on health and are creating powerful partnerships and deep commitments to making change. And you can go to the link that Kate will give you, rwjf.org, and see examples there of what the prize communities have done. And here's a quick map. We had the 2015 prize winners were announced in October of last year, and there'll be a new application process this year, later in the year. So I think we've gone over these points. What I think I'd like to do at this point is open it up and see if there are any questions that have come up, Kate, that perhaps we could answer during this brief Q&A time.
Have to unmute. I know we've had some questions coming in along the way, and we've been answering those, which is great. We did have a question about the data sources and the potential for expanding indicators. And I know Jan briefly mentioned this. So I did go to the data landing page, or the data detail, or the measure detail page on that website tour. That's a great place to get more details about the data sources. If you also go to the Tools and Resources tab that I was unable to get to, you can search for, there's a document there that will also show you the data sources in one spot for each of the different measures. As for expanding indicators, again, stay tuned for that January 19th webinar, and our data team will have more information about that then. I'm going to scroll through and see if we've got any other questions. So this is a great question that we sometimes get a lot. County health rankings, how do you use this data if you are a city? And I'm happy to take a first go at that. It's a great question that we get a lot for people that are part of a different geographic region or municipality than a county. So the first thing we say is use the model. Use the model as a starting point to frame your thinking about health, to maybe expand your city's thinking or your community's thinking about health. And then the county level data may be a good starting point for you. It really depends on the county and the city and how, you know, what the connection is there. But again, those additional data resources can be a great place to go to get some more data at a smaller geographic level in some cases. But we always say, you know, if the data is useful to you, it's certainly a great starting point. Otherwise, you know, we think that the model applies to everyone, regardless of whether you're county, city, region. And then the Action Center and the coaching that's available, you know, those tools and resources apply whether you're a neighborhood or a county or a region working together or a city. So we feel like there's a lot of great resources available to you. We know that it can be frustrating as a smaller municipality that there's not always the same level of data. But we hope there's some great valuable resources, and again, a great starting point for a discussion of how to address that smaller group.
That's great, Kate. And I'd also say, please feel free to contact us too if you have further questions. Just press that Get Help button and that'll get us immediately to us. There's actually 11 national coaches available to you free at no cost thanks to the Robert Wood Johnson Foundation. And we're here to help, whether it's a short email or a phone call or a longer term coaching engagement. Just let us know. We're just a click away. So we're going to wrap this up. I think we actually covered a lot of the questions that came in during the pre-registration.
Yeah, and we do have a few more coming in, and we can, I think, answer most of these offline as we want to be cognizant of time.
Sounds good. All righty. So we mentioned our upcoming and archived webinars. You can go to the webinars part of the site that Kate showed us. We'd also encourage you to stay in touch with us through social media. And we hope you feel inspired to reach out to others and take your next step wherever you are in your journey. We really want to thank you for joining us on this webinar, and we look forward to hearing from you in the future. And finally, we ask you to consider, as you leave, who else do you need to share this information with, and what is one idea for action that you're taking from this webinar? Thank you very much.